The UK Halo Registry is a registry of patients undergoing halo radiofrequency ablation at hospitals around the United Kingdom. About 3 or 4 years ago, when we first started doing halo treatment in the UK, the National Institute for Health and Clinical Excellence, or NICE, was asked to give its opinion on whether this treatment could be used in routine practice. And their view was that at that time it was an experimental procedure, and therefore any treatment that was done had to be done within some form of experimental context. And so what we did is we set up the registry to be able to monitor the outcomes of patients undergoing this treatment. And it really was set up for a number of purposes. First was to monitor outcomes, but secondly was to monitor who was actually going into the registry, who was being treated in the first place. What we found is that all the physicians around the UK are very keen to enter this registry. We currently have 14 centres around the UK who are in the registry, and we have another 3 who are coming on board as we speak. The aim is to get all the centres around the UK eventually in, and as new centres start doing Halo, we're inviting them to participate. The National Institute for Clinical Excellence, NICE, has now decided that Halo treatment is a routine practice within the NHS for patients with high-grade dysplasia within Barrett's esophagus. And what NICE has decided, and I was part of the guidelines development group for the management of ablative therapy in Barrett's, what that group decided was that it would be sensible for patients to be treated in specialist centres only. And so one of the requirements we have when asking people to join the registry is to demonstrate that the centres that they're being treated in are specialist centres around the UK. So as I say, we now have 17 centres that are about to come on board. We expect there will be another 10 or 15, and that will probably be all there will be in the UK, because the patient load is enough to support that number of centres and no more. The registry has now been collecting data for about 1.5 years. We have published at the Digestive Diseases Week, New Orleans 2010, our experience on the first 120 patients, and at the United European Gastroenterology Week, UGW, in the end of 2009, a subset of patients. So we currently have 14 centres who are actively recruiting patients into the registry. There are another 3 centres that are going through the approvals procedures at the moment, and we're inviting any other centres around the UK that are treating with Halo to join us. And we expect that more centres will come on board in the next few months.